Welcome to today's Practice Advantage Pro. Today I'd like to talk a little bit about the role of case managers in workers' compensation and how that's a unique customer for specialties where you deal with workers' compensation patients. Now, the role of a case manager is to coordinate many things. The return to work forms, the job evaluation forms, all those types of things in addition to medical, as well as some of the other nuances of workers' compensation. By example, most states have at least several forms, and this is an example from one state, potentially over 40 forms that could be completed on behalf of a person, an injured worker, for case managers to help navigate through. So I would say a fairly important role trying to navigate through all these different types of forms that are out there. So in managing with a case manager, a partner, what are some things a practice might do to optimize that or to really assure that that's a good partnership? One is, if there is a physician medical director in your region or area, it might be good to go MD to MD. Have a discussion about what services you provide. Maybe you're dealing with complex low back pain in your particular scenario, and there might be an opportunity for dialogue there, MD to MD. Now remember, most physicians that are working in this role have an occupational medicine background, internal medicine, or maybe a physical medicine or rehab background. They may not know the nuances of your specialty, so an opportunity there. Secondly, if you have an RN or a nurse practitioner on staff, most of the case managers have a background in clinical through their degree of RN or nurse practitioners, so it might be good to go clinician to clinician, RN to RN. One strategy that might work is they have chapter meetings, local chapter meetings. Case managers come together, share ideas, learn from each other. It might be a nice way to help show the partnership by actually hosting or offering to host these meetings at your particular site, your institution. Secondly, they always are looking for CEUs. They're nurses typically, they need CEUs. You might have an opportunity to provide for them either distance learning or an on-demand complex case review from your specialty that they could benefit from. The work comp case manager on your team, if you are large enough and have enough work comp cases, can be a great liaison with the clinical team on your side as well as the case managers. So if you do have a large number of injured workers in your mix, having somebody that's designated as the liaison can be a powerful partnership. Web access today has changed tremendously. You can have secure portals where only through password protection the case managers can access some of the note-taking things that you're doing on the web. That's an opportunity to provide value for them. When the patient is being discharged or toward the end of their treatment, when it comes to the injured worker, invite the case manager to participate in that. They'll want to be a part of that, but include their schedule as well as the patient's schedule and your schedule to coordinate that to make it easy for them to participate. Don't put up barriers. And then finally, are there ways that you can send out notes, medical records, and key information to the case managers proactively so they don't have to keep asking you for that? So some ways to partner up with case managers in a workers' comp milieu that is very complex, and it may be a helpful way for you to demonstrate in the marketplace that you're a willing player to help manage these injured workers to their success, whatever that might be. Thank you for joining us for today's Practice Advantage Pro.